Hello, my name is David Suskind. I'm a professor of pediatrics at the University of Washington and a pediatric gastroenterologist at Seattle Children's Hospital. And today I get the pleasure of speaking to you about diet and inflammatory bowel disease. Diet is a very important issue, not only in inflammatory bowel disease, but in all of life, because the foods we eat impact how we do as human beings. Now, I'm going to be talking about a lot of information during this talk in a very short period of time. So if you want to get a concise synopsis of what I'm talking about, know that there is a free comic book online, and all you have to do is search Professor Nimble, and you'll find it. So let's begin. So it's important to understand the impact of diet in inflammatory bowel disease. And I'm going to highlight this one young individual who came to me and utilized diet as his primary therapy to emphasize the importance of diet in IBD. And this was a 14-year-old young man who had a 3-month history of abdominal pain, loose stools, and weight loss. When we looked at his labs, we saw that he was anemic and had elevated inflammatory markers. And so we went forward with an endoscopy and colonoscopy, and the findings were consistent with inflammatory bowel disease. And you can see here, his terminal ileum, that last part of the small intestines, is inflamed, is irritated, is ulcerated, consistent again with Crohn's disease. Now, the family wanted to avoid medication therapy and asked if there were potential dietary treatments to use. And I'm going to come back to this young man at the end of our talk, but now we're going to kind of focus on why is diet important. And there are many, many different reasons why diet is important and how diet has been associated with IBD. Now, if you look to the left, you'll see a number of different pictures showing that the incidence of inflammatory bowel disease has increased steadily over the last 50 to 100 years. And this is not only true in Western countries like North America, as well as Europe, but also in Asian countries that have become more newly industrialized. In addition, we're seeing this increase not only in adults, but also in pediatrics. And this increase says that environment plays an important role in IBD. And specifically, what has changed? The diets of these countries during this time period. Now, other important reasons why diet is important includes the fact that our medications, although good, don't work completely and don't work necessarily for everyone. And if you look to the right pictograph, you can see a very famous study called the SONIC trial, where they looked at azathioprine and infliximab either by themselves or in conjunction. And you can see even when used in conjunction with each other, over 40% of individuals did not respond to medication therapy at 26-week point. And then finally, another extremely important reason why diet is important is because the financial impact of active disease is significant. And if we can decrease that, if we can decrease the amount of active disease that individuals have, we can not only help individuals financially, but also the medical world in general. So how is diet implicated in IBD? Well, to understand how it's implicated, we have to understand how the GI tract interacts with the microbiome. So in a perfect world, we have the microbiome, which is the bacteria within our GI tract, the lining of the GI tract, or the mucosa, and the immune system all living well together. But something happens in inflammatory bowel disease. These areas change. The bacteria becomes dysbiotic, or becomes, for lack of a better term, bad. The mucosa gets broken down, so there are holes that develop in them, or ulcers. And the immune system activates, becomes revved up, and starts attacking the bowels. And diet, as we'll see, has been shown to cause all of these issues. And so focusing on diet is important. Now, let's take each of these areas by themselves. First, the fecal microbiome. What is that? Well, that's 100 trillion or over 100 trillion microorganisms that live in our GI tract. Now, if you look at that number, that's about 15,000 times the number of people in the world just living within our GI tract. Each one of us has about 100 trillion microorganisms. And for each one of us, our microbiome is different. It varies. It's personalized to us. And our microbiome is active. It's adapting. It's adapting to the individual. It's adapting to you, your body, which is their environment. Now, how is diet implicated with the microbiome? Well, what I want you to do is think of animals. I want you to think of multicellular animals, not bacteria, but multicellular animals like a tiger, like a dolphin, a panda, a gorilla, a cow. And if we fed all of these animals the same food, let's take hay for instance, it would not be surprising to us that a number of these animals would not survive, and we'd end up with a lot of cows. Now, if we substitute these animals with different types of bacteria and substitute the hay for the foods that we eat, the same premise holds place, meaning that the foods we eat are then eaten by the bacteria in our GI tract, and depending on what we eat, will shift the type of bacteria that live within our GI tract. And we do know that the microbiome is implicated in inflammatory bowel disease. And we know that there are specific changes to the microbiome which is associated with inflammatory bowel disease. Certain organisms like Fecal Bacterium perniciae go down, and other organisms like E. coli or other Enterobacteriaceae will increase. So we know that the microbiome is important, and we know that shifting the microbiome can improve how patients do. Now, there are other parts of the GI tract that are important as well. And we talked about the mucosa, that lining of the GI tract that keeps the 100 trillion bacteria away from our immune system. Now, there are a number of important components to the mucosa. And if you look at the picture on the left, you can see on the top of the cells of the mucosa is a blue layer, and this is a mucus layer. And this mucus, this thick secretions from the intestines actually keep the vast majority of bacterial cells away from the lining of the GI tract. So it's literally a barrier that keeps the bacteria away. And we know that certain foods can actually affect that barrier, break it down, as well as have effect on the intestinal cells themselves. And there are many of them, and we're not going to go over all of those today, but a lot of these foods are highly processed foods. Foods that have lots of emulsifiers in them, are high in sugar, have other food additives that impact the mucosa itself. And I'm going to run through some of the science with you as well. And this is a really great study by Martinez Medina. And what this scientist did was looked at a high-fat, high-sugar diet and looked to see what it did in animals that were predisposed to developing IBD. Well, one of the big things it did, as we talked about before, it increased E. coli, which is a pro-inflammatory bacteria that lives in the GI tract of many individuals with IBD. But it did other things as well. If we look to the left picture, you can see that a high-fat, high-sugar diet, as defined by HFHS, it brought out a protein called claudin. And now this protein is actually a pore-forming protein, which leads to the proverbial leaky gut that we see in inflammatory bowel disease. Another thing that a high-fat, high-sugar diet did, if you look onto the right picture, is that it decreased MUC2. And MUC2 is a very important component of that mucus layer. So it actually thinned out the mucus layer. And it's not just a high-fat, high-sugar diet, but there are other components that can affect that mucus layer as well, including emulsifiers, and this is found in a lot of foods. And in this study by Nickerson, they looked at maltodextrin. And maltodextrin, again, in many foods, processed foods, was seen to break down that mucus layer. So if you look at the control on the left, you can see this black layer. And this black layer is keeping all these little red dots, all these bacteria, away from the green lining of the GI tract. But if you look at the maltodextrin, the MDX picture, you can see that the maltodextrin has broken down that mucus layer, allowing a lot of these bacteria to get closer to that epithelial cells and therefore the immune system. And there can also be a direct effect of foods on the GI tract itself and inflammation itself. So there are many foods that have been studied, some of them as being pro-inflammatory, like wheat germ gluten and amylase trypsin inhibitors, and many that can be anti-inflammatory, such as isothiocyanates and polyphenols. And having the right balance of these foods in a diet can affect how the immune system functions. So what about the clinical studies that have been done? How does diet, or how has diet been studied in inflammatory bowel disease? And there have been many different diets that have been studied, but I'm going to focus on two of them: exclusive enteral nutrition and the specific carbohydrate diet. These are two examples of how diet can be utilized in IBD. Now, exclusive enteral nutrition is probably the best studied dietary intervention in inflammatory bowel disease, specifically Crohn's disease, and has been shown to work so well for Crohn's disease that it is recommended as first-line therapy by NASPGHAN, which is the North American Society of Pediatric Gastroenterology and Hepatology, as treatment for Crohn's disease. And this is when you take a formula and formula alone for 8 to 12 weeks. No other foods or drinks, and this can be either taken orally or via a nasogastric tube. What has been shown in many studies is that EEN works equally as well as steroids in inducing remission, which means that EEN can make all the disease activity go away and make all the inflammation go away. And I'm going to highlight one study here. This is a study by a group led by Borelli, which highlights how well EEN works. So if you look on the left-hand side, you can see that EEN and steroids work equally well to get patients doing better clinically, and that's the PCDAI, and you can see that the slope downward is equal in both. And you can also see that the inflammatory markers that we check in Crohn's disease, the CRP and the SED rate, also normalized equally in both. But there was a difference in this study, and there is difference in other studies as well. With EEN, you actually had better mucosal healing, meaning that the ulcers in the GI tract were healed much more effectively by using EEN than by using steroids. And you can see here that in the steroid group, there was some healing, but it was much more dramatic for those on EEN. Now, my area of research and my area of interest is the specific carbohydrate diet. And this is a diet that was studied by initially Sidney Haas and was used to treat celiac disease. It was then popularized and refined by Elaine Gottschall, and it really focuses on a whole food diet, meaning that the foods that are eaten are fruits and vegetables and meats, as well as a fermented yogurt for 24 hours. What it removes is grains, sweeteners outside of honey, milk products outside of hard cheeses and yogurts, and food additives. And so it does remove a fair amount of the processed foods that we eat today. And we and others have done a number of studies, and I'm just going to highlight a few of them here. This was one of our first prospective studies where we looked at active Crohn's disease and ulcerative colitis. And these individuals had disease coming into the study and were not allowed to change any of their medications. The only thing they changed were the foods that they ate. And we followed them for 12 weeks, looking at them clinically, their laboratory response, as well as their microbiome. And this slide just shows that in terms of clinical remission, that the majority of patients did reach that and improved significantly through the 12-week study. And in terms of the inflammatory process, we saw improvement there as well, with a lowering of the CRP, the sedimentation rate, and the calprotectin. What was also interesting was that shift in the microbiome. So these patients' microbiomes were checked throughout the study. And this is an example of one of the individuals. This individual had a very high E. coli and Ruminococcus gannavis, two organisms that have been implicated in inflammatory bowel disease. And you can see that the percentage was high at the beginning, 12 and 15%. But as the study went on, the number of E. coli and Ruminococcus decreased substantially to 0.2 and 1.9%. And we checked the microbiome in all of these patients, and the vast majority had changes in their microbiome. But as we stated, the microbiome is different for each individual, so the changes that we saw were also different for each individual. And we then moved on to a Crohn's disease study where we used 3 different diets. We used a modified SCD, an SCD, and a whole foods diet. The modified SCD had oats and rice. And we, like our first study, followed them for 12 weeks, clinically, as well as their labs. And this is the synopsis of the clinical and laboratory evaluations. What we do see is that by eating an overall healthier diet, patients seem to feel better and do better overall clinically. And we also saw improvement in their inflammatory markers. With the SCD and the modified SCD having the biggest impact, But we also saw improvement in the whole foods diet, which means eating a healthy diet, even if you're not going on an exclusive diet, can potentially be beneficial. So this comes to the crux of the question. What should patients with IBD be eating? And each individual really needs to talk to their physician, needs to talk to their dietitian, because each individual's dietary needs may be different. But we can say that eating a healthy diet, which is rich in fruits and vegetables, and low in processed foods, is good for you, and especially low in high sugar, high fat foods. The other positive thing to say is that we're continuing to research this area to better define what would be the optimal diet for somebody with IBD. And there are a number of studies out there. One is the produce study, which is personalized research on diet in ulcerative colitis and Crohn's disease. The other is DINE-CD, and these are large multi-center studies, again, looking at diet in IBD. So let's come back to our initial patient. He had decided to do EEN and then transition to SCD. He maintained clinical remission for over 3 years and laboratory remission for over 3 years. And at the 3-year mark, he had endoscopy and colonoscopy, which was completely normal. This is the terminal ileum, the same terminal ileum that you saw at the beginning of the talk. And the biopsies were also normal. So in conclusion, diet matters. Whether you decide to do something like EEN or SCD, it's going to be important for all of us to eat a healthy diet. Thank you so much.